In today's video, we're diving into a topic that might make your eyes water just thinking about it: pink eye. If you've ever noticed your little one sporting a red, gunky eye or two, you might be wondering, is it pink eye? And what do I do about it? Well, don't worry, because we've got you covered. First off, let's talk about what pink eye actually is. Also known as conjunctivitis, pink eye is a common eye infection that can be caused by bacteria or viruses. It happens when the membranes surrounding one or both eyes becomes inflamed, leading to that signature reddish or pink color. Most of the time, it's a mild condition that either goes away on its own or is easily treated. But sometimes, especially in newborns, pink eyes can be more serious. Causes of pink eye. So, what causes this icky, sticky infection? In babies and toddlers, pink eye can be caused by a few different things. First up, we have infections. The same viruses that cause the common cold can also lead to pink eye. Bacteria, like the one behind strep throat, can be to blame too. In newborns, infection can occur during birth if they're exposed to bacteria or a virus in the birth canal. Next, we have blocked tear ducts. About 10% of babies are born with narrow or blocked tear ducts, which can cause irritation and pink eye. And lastly, sometimes the very thing meant to prevent eye infections in newborns, antibiotic ointment or eye drops given right after birth, can actually cause mild conjunctivitis. Symptoms to look out for. Now, let's talk about what to look for if you suspect your baby or toddler has pink eye. The most obvious sign is, you guessed it, pink or reddish eyes. Other symptoms might include swollen eyelids, clear or yellow discharge that can be stringy, crusty eyes that stick together, itchiness, watery eyes, pain, frequent blinking, and sensitivity to bright light. Viral versus bacterial pink eye. So, how can you tell if your child's pink eye is viral or bacterial? Viral conjunctivitis often comes along with cold-like symptoms and watery discharge, usually affecting just one eye. Bacterial pink eye, on the other hand, tends to cause thick, goopy, yellow or green discharge and can affect one or both eyes. It often goes hand in hand with ear infections and can occur shortly after birth. When to see a doctor. If your newborn shows any signs of pink eye, it's important to call your doctor right away. Infections in new babies can be more serious than in older kids. For babies and toddlers, while pink eye will usually go away on its own in a few days, it's still a good idea to let your healthcare provider know if you notice any changes in your child's eyes. Plus, if bacteria are to blame, antibiotics might be necessary. Contagion alert. One thing to keep in mind, pink eye caused by viruses or bacteria are highly contagious. As long as your little one has symptoms, they can spread it to others through eye secretions or droplets from sneezing or coughing. So, it's best to keep them home from school or daycare, encourage lots of hand washing, and try to keep those tiny hands away from their eyes. Treatment options. The treatment for pink eye depends on what's causing it. Pink eye from irritation usually clears up on its own in a day or two, no treatment needed. If allergies are the culprit, your child's doc might recommend allergy testing. For bacterial infections, antibiotic eye drops or ointment will be prescribed. And if a virus is behind the pink eye, you'll have to wait it out, as antibiotics won't help. For blocked tear ducts causing pink eye, gentle massage with a warm compress several times a day is often recommended. Most of these cases clear up by a child's first birthday, but if not, a procedure to enlarge the tear duct opening might be necessary. Providing relief. While you're waiting for pink eye to run its course, there are some things you can do to help your child feel better. Warm compresses can help loosen crusty eyes, while cool compresses can soothe puffiness. Just remember to use a clean compress for each eye to avoid spreading the infection. Thank you for joining us today. If you found this video helpful, don't forget to like, share, and subscribe for more insightful content.